Hello and welcome to the ABC News On Call Plus special section on women's health. I'm Dr. Jacques Moritz, and I'm joined by Dr. Michelle Francis of St. Luke's Roosevelt Hospital to discuss infertility, some of the common reasons for it, and what options women with infertility may have. Michelle, what is infertility?
Infertility is defined by your inability to get pregnant over the course of a year. That's the technical term.
And how often does this happen?
You know, it depends. If you're a woman that ovulates regularly, 85% of those women should be able to get pregnant within the course of a year.
Right.
However, when you're not ovulating regularly, it can be a lot more difficult.
And what do you find to be the most common reason for infertility, for people not getting pregnant?
The most common reason for most women is tubal infertility. And that means that their tubes are scarred and it may be difficult for the egg to get into the uterus so that you can get pregnant.
Okay, and the good news is that if you have this tubal infertility, your tubes are blocked, with in vitro, which is IVF, you can kind of bypass it, which is great news.
Yeah, exactly. It's the easiest form of infertility to overcome.
Okay, and then if somebody comes to your office and says, I haven't been able to get pregnant in a year, just briefly tell me, what do you make them do and what do you have to find out?
Well, a couple of things. I usually have patients come in around day 2 of their cycle just to test some basic hormones.
Right.
I also invite them to come in and either talk with their husband about the possibility of male infertility, meaning that the man has an issue with their semen. So
Right.
I actually recommend semen analysis, which is one of the least expensive parts of the workup.
Right.
And then
But the hardest one to get somebody to go to.
Well, you know, it requires a man to ejaculate
Right.
into a cup
Right.
and then hand it in for analysis, so
Right.
that could be a big...
Right. And then what's the last thing that you do?
Usually I ask them to go for what's called a HSG or a hysterosalpingogram.
Right.
And it's a little bit of an uncomfortable procedure, but what they do is test the woman's tubes to see if they are open. If they are ovulating regularly, their day 2 labs are normal, semen analysis and the hysterosalpingogram are normal, then I usually recommend that they see a fertility doctor.
Great, and that's great advice.